Eric, for somebody tuning in right now, saying to themselves, I've tried all the diets, I've tried all the different lifestyle modifications, and I've been stuck carrying this extra weight for the majority of my life. And I feel like this is just who I am, and I'm hopeless beyond, just kind of maintaining where I'm at or having small ebbs and flows when it comes to weight loss and weight gain. What would you say to them?
Well, you're describing just about everyone who comes to me in my office at Duke. Everyone says I've tried everything, and then I have a form where you fill in everything you've tried. And, well, no, you really haven't tried everything. But medical weight loss is what I'm trained in. Obesity medicine is the subspecialty. I'm an internist, internal medicine first, then obesity medicine specialist. I'm not a surgeon for weight loss. People come to me primarily metabolic changes like diabetes and weight management, weight loss. And I basically ask people to tell me their story, and I get the feedback that no other doctor really took more than a millisecond to listen to someone's story. And actually, I'll listen very carefully and have someone realize that they haven't tried everything. It may seem like you've tried everything, and then as I get into it, and people start looking at the wall chart that I have of foods, and they're categorized basically by carbs. The super high ones, super high carb foods, are all in a little red box at the bottom. To avoid these. They look up and they go, oh, I did do the Atkins diet once, and, it worked really well. And, oh, okay. Well, okay, so what I do is very similar to what the Atkins diet is. And, well, so I guess the first thing I do is listen and then give hope, because I've had people come to me who they've had diabetes for 20 years on insulin. And just a simple thing like changing the food. And you do have to be very strict about it if you're going to try to fix diabetes. It can be very powerful. So I say, maybe you haven't tried this. And if it's the first visit to me, I'll even say, well, you haven't tried it with me. And so, it seems like everyone is searching and trying to find the one simple answer. And that answer actually has been around 150 years, and that's to cut the carbs out. It's focusing on sugar as the culprit, not fat or calories. That gets too confusing, but there's a lot of ways to be healthy. And if someone's ending up in the Duke Keto Medicine Clinic, which I call it now, they've usually tried just about everything, or they feel like they have. And I like to start with lifestyle because it's very potent, and most people can wrap their head around it and do it if they know the detail, to be strict about it. Your body starts burning its own fat, and that's a wonderful thing. Feels great.
Well, that sounds like a great thing, especially for somebody who has lost a lot of that hope and they've been carrying extra weight for a lot of years. We know carbs is a big piece of this, but let's start with somebody coming to your office. You gave that example, diabetes, 20 years. What is the first step?
As of the last 2 years, I'm now treating and helping, teaching people over the internet more than I am in my office. And this is fascinating because it is so robust. It works so well if you teach it in a certain way. People don't even have to come see me or see a physician unless you're on medicine. So I've kind of learned the safe use, the guardrails, if you will, of how to use a very potent lifestyle method. And the first thing to do is develop rapport. If someone comes to me, they're on 10 different medicines, usually from 3 different doctors. And I'm going to be the one to come in and say, oh, you can stop all the... No, it's a process. I need to first develop rapport. Now, it's fascinating. Some people come to me, they've already watched every YouTube video I ever did, and they some of them know the name of my firstborn child, and others have no idea. And others are referred by the orthopedic surgeon because they need to have a knee replacement or a hip replacement and they're too heavy. Or the heart surgeons actually send me people who are too heavy for a heart transplant. So, but even then they might not be motivated enough to wrap their head around stopping, sweet tea. That's a delicacy. No, it's a staple in the southern United States. If you ask for tea, you get sugar tea, you get sweet tea. So you have to ask for unsweet tea in the southern United States. But so developing rapport, getting an idea of the medical issues going on, if you're on medication and have medical issues, it requires the knowledge of someone trained in this, because I can take people off medicines very quickly, and you have to be careful. Now, let's say if you're not clinically ill, you're not on medicines, all this, gosh, it really is just as simple as cutting down the carbs. And the degree to which you need to cut them down depends on your metabolism, depends on your age, depends on your activity level. And it kind of, the low carb world kind of selects out 3 different categories. So if you're young, healthy, active, you're a biker and you're, running marathons, you can have more carbs than if you're, you've hurt your knee and you can't exercise at all, and or somewhere in between there. So there are different carb levels, I think. But as a place to start, if someone ends up in an office or wanting to take one of our courses to learn how to do it, my philosophy is to get it to work the first time, every time. And so I teach people the strictest version of it so that I know that their body will become a fat-burning body, and they'll start changing the metabolism in a very, very safe and quick way. If imagine you went to the doctor and you had a infection, sinusitis, and the doctor said, well, this is a difficult pill to swallow, and it's very expensive, and it's hard to do, but here, take this pill. No, and it might work. No, what I do is teach, here you follow this list of foods. It's been studied so much, it would be approved as a prescription drug if there were a process to approve diets, but there aren't. So that's why I use a very strict version of a low-carb keto diet when, often people have selected themselves out. They know what they're getting into. Other times people have no idea, and I just kind of explain how our bodies work. A doctor means teacher. So really all I'm doing is teaching as a doctor how our body works.
To keep that hope piece going early on in the conversation, for that person, again, coming back to our example, who is on medications, they're type 2 diabetic, and it's been a lot of years, meaning their pancreas has been pumping out so much insulin trying to regulate blood sugar, and it's been overworked for a period of time. Is there still hope for that person, or is there a point of no return if you've pushed it beyond a certain point?
Oh, well, so there's always hope. And it's fascinating. The nuance to what you're saying is, if you give insulin, actually, if you give a hormone to the body, generally speaking, what the body does in response is to suppress its own hormone secretion. So it's very possible that the long-term people getting insulin, the pancreas is kind of getting lazy and sluggish and not running out of insulin. And that's one of these common things I hear today. The endocrinologists, straight endocrinologists, are saying, "Oh, you've run out of insulin and you need it." And that you can even read that as what diabetes is. Type 2 diabetes is your body's it's run out of insulin. No, the insulin's already high, like you're saying. It's pumping it out, and you actually reach this kind of a point where it stops working, and so you escalate the insulin higher. I had someone on 600 units of insulin a day and got her off in 8 weeks. 600, so if the usual dilution isn't enough, they go to the double strength dilution. If that isn't enough, there's a triple strength. And it's like you just keep going up. So yeah, I've had people, even if they've been on insulin for 20 years, get off the insulin in as little as 8 weeks. And sure, I suppose if you treated 100 people and they'd have diabetes for 20 years, maybe 10% wouldn't get off insulin, but just about everyone does. Right? So, and we can actually measure whether your body is making insulin not by measuring insulin, because if you're injecting it, your blood level will be the injected insulin as well, but by measuring the insulin precursor called C-peptide, and that gives you a measure of whether your body is making its own insulin at all. Sometimes I've had people be told their body isn't making insulin, and we measure a C-peptide, and it certainly is. So there are these shortcuts that doctors take, and even then unwittingly perpetuate the problem. I mean, if you have type 2 diabetes, your insulin's already high. You don't want to go on insulin. That's just going to make you gain more weight, and you'll always have diabetes. Oh, well, wait, that's what the doctors say. You're always going to have diabetes because you're on insulin. It locks you into this gaining weight and having insulin resistance. And so now, fortunately, the diabetes world, and remember, I'm an obesity medicine doctor, not a diabetologist. We have different training. They're bumbling upon medicines. Well, that's not a good term. They've discovered medicines that actually make you lose weight while you're treating the diabetes. And that's the kind of medicine that you want to get on. If you've been taught, if you're obese and if you're heavy, you have type 2 diabetes, don't go on a medicine that lowers the blood sugar and makes you gain weight. Go on a medicine that lowers the blood sugar and makes you lose weight at the same time. And then, it's going to jumpstart you to that weight loss and diabetes fixing. But I can accomplish so much by just changing the food. I don't use these medicines that are now being used to lower blood sugar and have you lose weight. I suppose I could if asked. I might, but the diet itself is so powerful. But insulin, to inject insulin, if you're type 1, you need it. Saves lives. But the type 2s on insulin will really never get better. And you hear that language, will manage your diabetes, right? On these ads on TV, manage your diet. No, we want to reverse it. We want to fix it. And it is reversible, fixable in just about every case. At a recent meeting, I met a couple of young doctors from Malaysia. And they came up to me and, oh, Dr. Westman, great to meet you. We're doing what you're doing on the internet, and basically taking people off diabetes medicines. And I asked, well, how do you make sure it's safe? Well, we give people continuous glucose monitors, and as their blood sugars come down, we take people off their medicine. And I said, well, how do you know to do that? I said, well, we'd rather have it a little high, a little lower. How did you learn that? I asked. We watched your video, Dr. Westman. So the information gets out in very interesting ways. And I said, how many of what percent of your type 2s on insulin get off insulin? And they looked at each other very quickly. Everyone. So this was demonstrated in a clinical trial by Virta Health and published in peer-reviewed papers that they quote 70% of folks got off insulin within the 1 to 2 years they were having people do it. But so clinical trials actually, in my experience, are not as powerful as having a doctor be able to. I mean, I can do things that I couldn't do in clinical studies because our protocols were constrained. And so I can find I do even better than what our study showed, because I can talk about the son with whatever problem, or the husband, or use all of my doctor techniques to support people as well, which in a clinical trial we're much less enthusiastic and less of a cheerleader. It's more, we want to see how the diet does, but in a clinic I can be part cheerleader, part coach, part doctor, all at the same time, psychologist, supportive therapist during COVID times. But what you can do with diabetes is really amazing to reverse it, fix it, or reversal is kind of the term, because once you start talking about curing something, it raises hackles about quackery. And this is not quackery, it's science.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
I've had people, even if they've been on insulin for 20 years, get off the insulin in as little as 8 weeks. The weight loss happens about 1 to 2 pounds per week. My philosophy is to get it to work the first time.